Okay, welcome everyone. I know we're waiting for some more people to join us, but I wanted to welcome everyone who is here today and celebrating our 13-year anniversary all week long. We're so excited. We've been seeing a lot of people in the office, also asking a lot of great questions. So thank you for joining on our daily webinars, our Instagram live videos, and coming into the office for your complimentary consultations. So today it is all about hair thinning and how we can, during our Power Couples event, it's all about how do we couple powerful solutions with very common problems that include both products and procedures. So this is your solution to hair thinning for both men and women. Let's go to the next slide. And by the way, we are going to be giving away $13,000 in prizes to celebrate our 13-year anniversary. So just for being here, you're automatically entered into a raffle. And we will be announcing those winners next week. So thank you very much again for joining. You will also get a free gift just for being here today through your email. And I wanted to also welcome my co-host, co-speaker, Dr. Melissa Anzalone, who is the medical director trainer at Nutrafol, which is one of the hair solutions that we'll be discussing today. Let's go to the next slide. So if you are dealing with losing your hair, hair thinning, whether you're a male or female, you are not alone. Now, there are lots and lots of causes for hair thinning and hair loss. The main diagnosis that we'll be talking about today will be when it comes to the genetic hair thinning, male pattern hair thinning. So if you are a male who is showing some signs of receding hairline, especially in the front area or the temple area or the crown area, and especially if there's a family history of this, you likely are suffering through male pattern hair thinning, which is so common. Next slide. If you're a female, it is called female pattern hair thinning. And in this case, you might notice an increase in your parts showing, thinning out, more hair show, more scalp show. You may have a little bit of a receding hairline. Do not worry, you will not grow bald, but you will notice more hair thinning and hair loss, especially at the top area of the scalp. Now, the medical condition for this is androgenetic alopecia, which is very similar to male pattern hair thinning in that it tends to be genetic, also made worse through other things such as stress and aging and menopause, unfortunately, for women. Now, for males, where it might be socially acceptable to thin out or grow bald, in females, it is not acceptable. It is unacceptable socially. So it can be very, very distressing among men, but even more so among females. Next slide. So what are some other types of hair loss? Again, this talk is really for those who are suffering from the genetic type, the male pattern hair thinning, the androgenetic alopecia. However, there are many, many, many types of diagnosis when it comes to hair loss. And these are just some of them. And my talk really is not all inclusive to these types of hair thinning, but you should be aware of them because you will need to get diagnosed and treated properly. Next slide. So if you look like you may have more hair loss, especially if you've got more coin-shaped lesions, that could be something called alopecia areata. If you're noticing hair thinning everywhere with top, back of the scalp, and just your ponytails getting thinner, you might be suffering another condition called telogen effluvium. There's some autoimmune conditions such as lupus that can also manifest in hair thinning. If you're going through postmenopausal changes, there could be other types of scarring alopecia, we call it, called frontal fibrosing alopecia. African-American hair and hair of color also goes through very unique changes and unique hairstyling practices. And, that could be another cause and reason for hair thinning and hair loss. Next slide. So interestingly, this is a very, very common concern among men and women, and millions of people are undergoing this as we speak. And so you're not alone. It's important to know that there is something that you can do about it. It's interesting that how devastating it is. 47% of people who are hair thinning or have hair loss would actually spend their life savings to just regain their full head of hair. It just goes to show you how important and socially acceptable it is and unacceptable it is to thin your hair. 60% of hair loss sufferers would rather have more hair than money. So I thought that was funny, interesting. And these were taken by the AAD, but again, shows you the importance of having a full head of hair. So what are the reasons? Next slide. There's a variety of different reasons, the main one being genetics and a family history of hair thinning and hair loss in both men and women. There could be other things going on. So stress is a big one. With any skin and hair condition that I see, the more stress you're undergoing, the more hair thinning you will have. I told you about the postmenopausal, menopausal, perimenopausal women. There's a lot of hormonal imbalances that could be going on. And so that is another trigger and stressor for the hair. The natural aging process, we're certainly not going to keep our full head of hair all throughout our lifespan. So it's just natural that we're going to thin out with age. Life events such as pregnancy and childbirth will cause a short-lived hair thinning process, which will come back with time. And chemical products are a big one when it comes to hair thinning. And especially if you've got hair of color where it is harder to, tame because it's curlier, you're using a lot more excessive chemicals in hair and heat. So that's very important to take a look at that. Next slide. Another big reason most recently is COVID. So we saw lots and lots of hair thinning because of COVID. And there are a couple of reasons for that. So that was a huge life change for a lot of people, lots of things going on. And we know that part of it is due to stress. And so the stressors, which is staying at home and social isolation, causing some more depression and anxiety, certainly caused hair thinning to happen. Now, if you are one of many who also went through having COVID, which can be very difficult on the body, and you got really sick, well, your hair is not immune to that. So there's a lot of inflammation in the body, including the hair, that could cause what we call a cytokine storm, this inflammation in the hair, and that caused a lot of the hair thinning, generally all throughout the hair, not just in the front of the scalp, which is more genetically related. Next slide. So what happens when during a normal hair growth cycle? Well, we know that there is 3 different phases called the anagen phase, which is the growing phase. This is when anagen hairs are growing over several years. It can last. That can then transact to the catagen, which is our resting phase. And then finally, the telogen phase. The telogen phase is where you actually get hair loss. Now, what happens when you are undergoing these conditions is that the anagen phase or the growth phase is becoming much shorter in time, and the telogen phase is becoming much longer, so that that you can't get back to that growing phase quite as quickly, quite as easily. And this is described as follicular, also miniaturization, which means there's more thinner, shorter scalp hairs. We call them the vellus hairs. So these terminal thick coarse hairs are being replaced by thinner, shorter hairs called vellus hairs. And that's what's going on genetically. There's a program that turns on these hairs so that they're not growing and they're coming back much weaker and much shorter. Next slide. So when we talk about hair thinning, we talk about the Ludwig classification for both men and women. And so you can see in phase 1, there's just the start of hair thinning that's going on. And as time progresses, it can progress to a level 2 to a level 3 stage. In the beginning, it could be barely noticeable or very noticeable. And that's where usually people will get started on doing something for it, whether it's camouflage techniques, changing their hairstyles, starting with very conservative ways to manage this. And over time, as it gets severe, that's when our patients especially will look to doing even more solutions, more treatments that might be a little more invasive than just taking pills or solution. Next slide. Same is true with men. The idea is that you start very slow and over time it gets worse. It starts at the frontal or the crown area, receding hairline, and then over time you really get a loss of hair on that upper crown and frontal area. Next slide. So what can we do about this? So I've been talking all week about our approach to solutions with common concerns, and we call it our 360 protocol. When we're talking about the face, we call it 4 Ps to pretty skin. The same method applies to hair. So the first P, we want to prime our skin, or in this case, prime our scalp, so that we can get the best results with and go deeper as we incorporate more and more treatments. The second P is to peel or exfoliate the skin. And so by exfoliating the top dead layer of skin, we're going to get increased and better penetration of the other products and other procedures that we are doing. And with going deeper, you're going to get better results. Step 3P is procedure. So now we actually do the procedure and we get better results because we're going deeper where the hair follicle lies. We don't have to worry about all that dead skin and we're going to get better results. Final P is to protect. So we want to protect the investment after all of the work that we've done and maintain our result. Next slide. So we're going to talk first about that first P, priming the skin. Generally, this is physician grade skincare. In this case, it's going to be hair care methods. Next slide. So at Elite MD, we've got a hair growth kit, which I love for my men and my women. Comes with everything you need. It starts you off. So when you're not sure what to do, what should I start with, and you get overwhelmed with everything that's out there, start with the basics. Priming your skin, priming your hair follicle will allow for the other things that we do to work better. So we do have QR codes here, easy enough. You can actually use your phone and QR code it, and it'll bring you directly to the site and tell you all about the hair products that are in there. It comes with a shampoo, a conditioner, as well as a dropper for the actual medicated product. Next slide. So there's a men's strength and there's women's strength. It includes, the dropper is a medical FDA approved over-the-counter medication called minoxidil, which you may have heard of as Rogaine. It was actually initially found as a hypertension medication, and they found the people that used it actually got a side effect of growing hair. And that's how minoxidil was formed. So this is a topical medication that is of different strengths. So if you are a woman getting a woman's strength, it is a 2% minoxidil. If you are a male getting the men's strength, it is a 5%. Now, the biggest issue with this could be the irritation that people can experience with this. So we recommend with women's strength at a 2%. If there's no irritation, you can always go higher to the men's strength at 5%. So that's really the only difference. And then otherwise, the other products are the same. The effect really, you want to stay on this for a good 4 months to start. So if you're going to do it. Otherwise, using it just for a few days, a few weeks, a month is just not going to be enough for you to actually see the results of new hair that's coming back, that's growing in. Generally, I recommend 6 to 12 months to really see the full benefit of this, because we know that in studies, it actually does work to grow some of the finer hairs and really rebuild some of this. Not saying you're going to go back to where you were before. It's not a miracle medication, but it is something to get you started off right. And essentially, people will use it twice a day, morning and night, massaging it into the scalp, and then leaving it on for about 4 hours at a minimum. Important, you don't want to have this obviously dribble into other areas that you may not want hair, which has been known to happen. So if it goes into the wrong areas, you actually can grow hair in other areas where you don't want it. So just keep that in mind as well. This is a wonderful, safe solution when you're just getting started to prime or even to maintain your hair growth. Next slide. And here's some before and afters. You can see that it did take a few months of treatment before you start noticing some of these results. The men's formula after 4 months, and then the women's formula after 12 months. So it is promising that you can do something as simple as home treatment with medical grade level care to really help you grow some hair back. You do have to obviously be very, very patient, but everything you need will be in there. Next slide. And now I'd like to have Dr. Melissa Anzalone take it away. And thank you, Dr. Melissa, for joining us today. Again, she is our Medical Director of Corporate Training at Nutrafol. So she is your go-to for any questions that you have on this drug-free formula. Thanks for joining us, Melissa.
Amazing. Thank you so much, Dr. Sonia. I feel like I've learned so much about your practice and just a lot about what you guys do here. Thank you for having me today. Really excited to speak to the effect of Nutrafol and how that is, it's like Dr. Sonia said, a really drug-free solution for hair health. If you could do the next slide there. And then really to bring you guys through our Nutrafol product offerings, we can skip to the next as well. Really taking you through our philosophy here, I think is really key. So the way that we approach hair growth is multifactorial. So we're looking actually at 6 different root causes that affect hair growth, specifically stress, hormones, environment, metabolism, nutrition, and aging. And we really see all of these components coming together to actually disrupt the hair growth cycle. So looking at, hormones, of course, we're focusing on DHT, right, to Dr. Sonia's point, looking at that follicular miniaturization. Stress, of course, right, looking at COVID, post-COVID, and how that stress hormone cortisol can really impact our hair growth, shifting the growth from the anagen stage to that catagen or rest stage. The environment, right, looking at anything you're eating or the pollution that is surrounding you. Metabolism, right, the metabolism is really providing the hair the energy it needs to grow. Nutrition, looking at key nutrients in the diet, and then aging too, this really normal process that occurs with time where our cells are really unable to self-repair at the same rate before they're damaged. You can hit that next slide, please. And then really here, we're looking at this physician-formulated, clinically tested and natural solution. We consider ourselves a multi-targeted comprehensive supplement with ingredients that address the many core causes of hair health, including hormones, stress, environment, metabolism, aging, and nutrition. And I wanted to point out here that we have a couple different product offerings. Specifically, we have our Nutrafol Women, which is for ages 18 to 44. We've got our Women's Balance for women greater than 45, and then our Nutrafol Men as well. You can hit that next slide, please. And then really looking here at all of our formulations, behind each one is a patented nutraceutical complex. So this is a main group of ingredients that is really targeting all those root causes that I talked about. So for example, we have curcumin in our products, really helping to focus on reducing inflammation and help with metabolism. We've got our ashwagandha helping to reduce stress on the hair. Saw palmetto, our natural DHT inhibitor. We've got our tocotrienol tocopherol complex, which is a potent form of vitamin E, helping to combat more of that environmental cause. And then on the right-hand side there, we are also fortified with things like hydrolyzed marine collagen and other vitamins that really help to support that nutrition piece. And you can hit that next slide, please. And then of course, we've got some great before and growings, which is what we call our before and afters. So here on the left-hand side, you can see this woman having this really wider part, right? More skin is showing through. And then after 6 months on the product, she really saw that fill in over time. You can hit that next slide. And then really looking at the example here, looking at the crown of this woman's head, you can really see that thinning right on the top there, and this real change after 6 months. You can hit that next slide. And then not to leave out our gentleman here, looking at that before, where we're seeing just so much of his scalp there, and then the real improvement there after 6 months of growing. You can hit that next slide. And here another gentleman, super young, right, 22 years old. He actually saw a significant change after 3 months. And, you know, he was really experiencing a lot of stress, right, between working the night shift and going to school full time. And he was really happy about his results here. Another gentleman, you're seeing that real thinning on the top of the crown right there. And this is his results after 3 months of growing. And then something that we're really proud of is the fact that we do have clinical studies behind our product. So this is a 6-month randomized double-blind placebo-controlled study evaluating the safety and efficacy of our women's product. So here we followed 40 subjects. We looked at changes in total hair counts, both terminal and vellus, and then we had physicians assess global photographs for hair quantity and quality. And then you can really see in that top right-hand corner, the difference, right? You can see that woman on day 0, her temple area is super thin, and then how that really filled in over that 6-month time. And you can hit that next slide, please. And then looking into our women's balance formulation. So this is our peri and post-menopausal solution for women over 45. So in addition to all those ingredients that I just mentioned in the Synergen complex, we have some additional ingredients here that support the unique physiology of a peri and postmenopausal woman. So we have something called maca, which is helping to balance sex hormones, right? Because as we go through menopause, of course, we see that decline in estrogen and progesterone. And then we also have a DHT blocking action in maca. So in addition to supporting the hair, maca can also provide some side benefits. It can alleviate menopausal symptoms, hot flashes, and other components there. And then we also have something in our women's balance called anthocyanin. So this is a really powerful antioxidant helping to anti-age both the skin and the hair. And then on the right-hand side here, we have extra cell palmetto to give the product a little bit of an edge as far as some additional DHT blocking support to really take care of this relative androgen dominance, right? This unbalanced testosterone that occurs once the estrogen and progesterone start to decline. And you can hit that next slide, please. And then just to show you as well, we have clinical studies, behind all of our products here. So this is a clinical study, a randomized double-blind placebo-controlled study looking at peri, during, and postmenopausal women. So here we studied those total hair counts, both terminal and vellus. And then we have an interesting endpoint here all the way on the right-hand side of shedding. So if you can see there, that kind of greenish looking line, that is a decrease in shedding on Nutrafol as compared to placebo, which is that gray line. So you can see that significant progressive decrease in shedding over the study there. And you get that next slide, please. And then just to give you guys some overview here, I know, kind of the main focus was those previous products, but we also have a postpartum. So we have a physician formulated and developed product. We actually partnered with a OBGYN that really leverages breastfeeding friendly ingredients to really focus on the particular causes that contribute to postpartum hair shedding. So here we're really focusing on nutrient replenishment, physical and emotional stress. So really helping mom to get her hair back post-birth. You can hit that next slide. And then we also have some complementary products. So we have what we call Nutrafol boosters and topical serums. So these are complementary products to all the products we just talked about. So we have a stress adaptogen, MD. This is a ingestible, a pill that you can take to provide extra support for stress. So if your hair is shedding a lot after a stressful event or just over time, this is a perfect product as an add-on. We've got our Hairbiotic MD, which really provides extra support for the gut by providing probiotic strains to keep the gut healthy. We also have a topical solution, so our growth activator hair serum. So this provides extra support on the scalp using a technology called ashwagandha exosomes. And then our newest product is our collagen infusion. So this is a powder really helping to provide extra support for aging of the hair and the skin. And you can hit that next slide, please. Oh, perfect. That is everything from my end. So happy to answer any questions that anyone has.
Thanks so much, Dr. Anselone. That was really, really educational. I do want to encourage anyone who has questions, they can use our chat feature and type out some questions, and we'll do our best to answer them. Thank you so much. It was super informative, and I learned a lot about more of the Nutrafol products. You know, we are huge proponents of the men's and women's formula. And in fact, everybody that gets any procedures done, that's the first thing we start them with, along with our minoxidil hair kit. And just that alone will get people at least supercharged for the next steps. And so thank you for all that wonderful information. So, you know, for everyone who's joining us, for those of you at home, the beautiful thing is you can get all of this on our website and have this delivered to your home. You don't even need to come see us just to get you started. But for those of you who want to do the supercharge and then know what's next, this is the next part of the talk, is what kinds of procedures do we have at Elite MD to help enhance the benefit even further. So now we get to my second P. My P2 is the peeling process, or the exfoliative process, so that products and procedures work better. Next slide. So we are really excited to actually launch a very new system, which is on the next slide here. I'm going to show you, is called the Keravive. This is from the makers of Hydrafacial MD, which is a super popular treatment that we do for exfoliation of the face for anti-aging, as well as brightening up the skin and, you know, a bunch of other things. So it's wonderful to be able to have this option that is simple, no downtime, easy. It's a spa-like treatment. It's what I go to. My first one whenever I'm here is I get myself in for Hydrafacial, but similarly, we could do the same thing for the hair. And I was just blown away, because that is amazing. If I'm able to do what I can accomplish for the face with Hydrafacial and put that into a Keravive treatment to help with stimulation of the hair and grow in your own hair, new hair, that is amazing. So we're really excited to launch this for the first time. Our staff just got trained, and they are super excited to be bringing this to Elite MD. Next slide. So the actual product itself comes with these specifically designed boosters, which are specifically for the hair to help nourish and hydrate and to really help with hair production. Next slide. And here are some of the before and afters with, again, just doing the basics of the first P, which is going to be the oral and topical, and then combining it with things like Keravive. Hydrafacial will be a very easy, non-invasive way to start growing your own hair. Again, all of this is all about patience. This is 4 months after. Next slide. Women obviously are just as eager to get this done and can grow their own hair, which is amazing, by doing things that are non-invasive. Next slide. I want to show you at least what you can expect. We don't have the Keravive videos yet, but we do have ones for the Hydrafacial. So I wanted you to at least get a feel for what it's like for the face, which is very similar for the hair.
I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. Everything
move, so instinctive and so passionate. Every word I move, so descriptive like an adjective. I got a vendetta against people who patented being negative when you should be getting after it. I got facts over tracks, this and that. Spitting slow, spitting fast, I could roast, I could gas. Think I'm okay at last, but I don't know if that can erase all the past. And the pettiness, a reflection of the emptiness. Hilarious, you think you're with my time, you're delirious. Mysterious, because you hide behind a fake exterior. Inferior, you know I'll always be a bit superior. Get off of me, this ain't no humble brag. I want you to hear words, you can say them back. I want you to feel free from the chains that last, and to believe in what you got, it was built to last, yeah.
Now that I've been put through, I never got anyone's help. I had to do it all myself.
I don't ever slow up, no I don't take sh**. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and
structure and function.
Okay, wonderful. So that in a nutshell is the hydrofacial, which is very, very similar to the hair. The main outcome here is trying to exfoliate some of that dead skin layer, allowing for hair growth factors to enter and penetrate into the skin to help with stimulating hair growth. So we're very excited to be offering that to you for the first time. Next slide. All right, now we get into the nitty-gritty of actual in-office procedures that are non-invasive and minimally invasive. So what can we do for those of you who want the big bang? What can we do to really get this done faster, quicker, and with more longevity? This is for you. Next slide. So our goal here really is to help with the hair growth cycle. We want to slow down the hair thinning and hair falling out. We want to reactivate those follicles to grow the hair. If they're programmed to still grow, we want them alive and well and nourished and be able to really have the seeds in there to grow so that we have a beautiful garden of hair that will grow over time. And then we're going to be talking about one of the most popular things that we do, which is hair restoration and some options with that. Next slide. So we talked about some of the topical solutions, including medications that are FDA approved and can be used for even off-label things like hair thinning. So minoxidil is one that is an over-the-counter that you can get at 2 to 5%, which we know is effective in slowly regrowing hair and especially keeping the hairs that you have today. There's another oral medication, which is a prescription for those people that qualify. The men especially are the ones that usually get on oral medications that can help to slow down hair loss. Some men don't like some of the side effects associated with it. So it can be a good treatment, but not always the most popular treatment. But there are some options when it comes to some prescription medications. Next slide. So the procedures we do in the office that have been effective and that we use as combination, because remember, it's all about coupling powerful procedures together, and a combination approach will always get you a better result than just one treatment or one single modality. So non-invasive options, we actually have something called the Hair Genie, next slide, which is a very easy treatment that is done. It basically uses laser and light therapy to help with increasing blood flow, helping with nourishing those blood vessels with microvessel stimulation, and nitric oxide, which is important for dilating those vessels and reducing some of the inflammation that might be occurring under the skin. So this is a very easy non-invasive treatment. We actually make it even stronger in that we have both red and blue and green lights in there to really help with combination therapy. Next slide. So the Hair Genie, really, like I said, we are big proponents of combination therapies. If I can do dual acting or triple acting treatments all in one session, I'm going to do it as long as it's safe and effective. So the Hair Genie does combine 3 technologies all in one. It uses the LED wavelength lights, combining red light, blue light, and green light, along with electromagnetic field therapy, which helps with improving circulation. And then finally, laser therapy as well under the skin to help stimulate more of the mitochondria to do the job and helping with blood vessel formation. So it helps to nourish the root of the follicle in order for it to continue to grow. Next slide. And so with time, there will be some hair growth that we can see again with several sessions. Non-invasively, we can see some new baby growth and hair growth with time. Next slide. So what other options do we have? Now, this next option is actually one of the best options that we have for someone who just wants it done, one and done, and you're good for many, many years. And you don't have the time or the patience to be doing treatments for long periods of time or coming into the office or, just being compliant and following a program. The surgical approach is one where we're known for innovation. We're a training center for the most innovative technologies in the world. We've seen patients from all over the world for these technologies, and SmartGraft is one of our reliable partners that we use along with our artists and our technicians and our board certified experts to really use a team approach to get you the best results. So at EliteMD, we're all about how can we do it safer and better with less downtime in the office, under a local, and just easier for our patients. So the old technique, which was quite brutal and it's still being done, is very different than the SmartGraft technique. The old technique, we would essentially cut out a large layer of the back of the scalp. We would dissect it, take out each graft and dissect them out, and then implant it into the area of insertion where we want it. The problem with this is it left a huge linear scar in the back. This old technique caused infection, the linear scar, it would staple or suture, and it was just more barbaric than it needed to be. So the newer technology, now that we're able to use a minimally invasive approach, we get less downtime, there's no linear scarring, there's no staples or sutures that are needed, and you get a wonderful natural result. Next slide. So the benefits of this newer approach is that it is done in the office. It is not as invasive as it once was. It's minimally invasive. It utilizes the most innovative technology so that we are doing everything we can as far as safety and efficacy and effectiveness for you. There's no knife or no sutures, no staples that are needed with this technique. There is no unsightly linear scar, which is very difficult to cover up, especially for men. There's a much faster recovery time. And the most important, it's still a very natural looking result that is more permanent. Next slide. So this is just showing a difference between the old technique versus the new technique, where with the old technique, you can actually be transecting some of your grafts. And if you are damaging grafts, you're going to have less grafts that will actually take. With the newer technique, it is much more precise, much more detailed in that we can implant the graft exactly where we want it in the right angle so that you're going to have a much higher graft take rate. So with a higher graft take rate comes a higher success of treatment. And so that's what I really love about this is that once I put it in, once that hair follicle is in there, it is in there, it is there to stay, and it will grow new hair. Next slide. So again, the benefits here are we're using much more advanced technologies than previously done. Most centers are still doing the older technique, which we were just, we didn't want to do that. We're always out for the next best, most innovative, FDA cleared devices that are going to work the best for our patients. So it's become the gold standard for us, utilizing the FUE technique and really being able to dissect each hair and implant it in the area of interest. It's minimally invasive, so no longer do we need sutures or staples or knives or linear scars, which is a huge advantage. And that allows for much quicker recovery times and permanent results, which is what we're all about. Next slide. And this is just showing the machine itself. It allows us to keep this very automated, and this tool down at the bottom is really the tool that we use to dissect every single hair follicle in the back of the scalp. We do shave the hairs very, very short so that we can actually use this small little tiny little drill to be able to access each and every single hair follicle that is then dissected out in an automated technique in SmartGraft. And then with a higher graft harvesting rate, we're going to have a higher take rate, and we implant it in the areas of interest, generally on the frontal scalp, the back of the scalp, the crown. And interestingly, we can do it also in women for eyebrows, which is really, 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 really cool. That is like the artist's dream, is to be able to do also eyebrows for those women who have over tweezed and have thin eyebrows. So there's a lot of wonderful uses for this. Next slide. This is showing you the old technique on the left, which left this terrible linear scar, and we were just not going to have that in Lead MD. We went out to take a look at other options that were there, so we didn't have to have this issue. And the technique that we use now doesn't allow for any sort of linear scar, which is fantastic. Very natural result. And you can see how men would not like the older technique. And I'm not sure if this plays. I don't believe it plays. Does it, Elaine? If not, that's okay. This is my husband getting it done. So we are our own patients and our own testimonials. So my husband has gotten this done. He has recorded himself getting it done. It's probably, I think, on our website. It's definitely on Instagram, and you can follow his journey. So we had this done by one of our artist who is an absolute, I mean, really a sculptor and a great technician to really be able to precisely put the actual implants where we want it in the right angle and to give you that wonderful natural design so that no one needs to know that you had anything done. He actually went on a plane that evening and went to LA the same day. Now, we do not recommend that, but just to show you, it was that easy and simple for him that he was able to actually travel the same day. Generally, we say a couple of days, you should be staying at home and taking it easy. You are going to have some swelling and some redness and some bruising, and you want to just kind of take it easy and just, if you want work from home is fine, but relaxing is the biggest thing to do for the next few days. Next slide. And so here are some of our actual patients who have had this procedure done, which is the innovative SmartGraft technique without the linear scarring, done in the office under local anesthesia. So a very common concern is that receding hairline, and especially at the crown. And by doing the SmartGraft technique, we were able to literally take one hair at a time and implant it in the area of interest. And like, look at him. He looks so amazing. We still see him back for other things, and he's just so incredibly happy. His wife is really happy. His wife is the one that sent him to us, and then he went and did it. Obviously, he was self-conscious, but not brave enough to come to us. But usually, they get in through the wives, and he was just incredibly happy and still doing well after. Gosh, this was probably about 5 years ago. All right, next slide. Another female who, again, like I said, thinning of the part area is what people will notice. The women will tell me, I'm seeing more of my scalp showing. I'm seeing more of my, more of my hair thinning here at the top. What can I do? So implanting exactly the same way as we do for the men. We do need to shave the areas in the back, and then we implant each an individual hair follicle into the area of interest, and that basically grows on its own, and you have your own hair that's implanted for life. Next slide. Here's another female, and actually the right side is the before, so I'm just wanting to show what it looks like, because we do need to shave the hairs under. Thankfully for the females, they've got long hair, they could cover that up, and obviously it's going to grow out just fine, but we do take out each individual hair from the right, and then we implant it to the area that we want, and this is just showing that, the hair grows back beautifully there. Next slide. And the wonderful, cool thing we get to do is we get to actually implant the hairs for women who have thin eyebrows. So we were able to, it's another artist technique. We're able to recreate the eyebrow really give a nice little angle, and all that hair, which is from the back of the ear, these small, thin, fine hairs are the ones that are used to help with eyebrows, and we can shape them. We can, you know, do whatever we want, and that hair will regrow on its own. Really exciting. A lot of women get this done. We do have to train the hairs, however, to grow in the direction that we want to. So that's the only thing, but it grows just like your natural hair. Next slide. Skin of color, African-American hair, much more curlier, much more delicate. It is a true expertise to be able to do hair transplants in skin of color and hair of color. That's one of our expertise here at Elite MD. I write books on skin of color, including skin and hair. So we have the experts to help you deal with that. So, you know, here's again, somebody, the right is the before, sorry, we've got that mixed up, but the right is the before, the left is the after, had hair transplant done. And you can see it's just a great, wonderful, natural result. And that's what this is about. Next slide. And some of these patients are just literally crying to you because we've changed their lives in so many significant ways that we don't even realize. I had one patient who was just literally on my doorstep every week, just, you know, begging me to have to help her with her hair thinning. Unfortunately, she didn't have genetic hair thinning. She had another kind of hair thinning that she needed to treat with her doctor. And we needed to make sure everything was treated and stable before we would even consider her for this treatment. Finally, after 2 years of just trying to hound me down to get this procedure done, we finally cleared her. Her other doctor cleared her and she had the procedure done. And oh gosh, I wish I had her picture in here, but she looks amazing. And she was crying. Like, you know, we do some life-changing work, but like, this is one of the most beautiful ones that we do because your hair really defines you. And she was just so thankful that we finally were able to get her in after 2 years of trying, and she just looks amazing. This is my father-in-law who actually had it done, and he is quite happy. He has a pep in his step now that he has hair. Next slide. Okay, so now that we've discovered all the different modalities in terms of options that you do have, what do? We want to, after doing everything we've done, protect and maintain our investment. Next slide. So the most important thing to do is really go back to P1. We primed our skin, really important. It's so important to continue with this because remember that the hairs that are not touched are still genetically programmed to fall out and thin out. So it's very important to maintain the hairs that you have. So the hairs that we implant will stay. It's the other hairs that you have to worry about. So I still recommend a maintenance regimen to maintain the hair that you have. In addition, we may add on other products. So sunblock, as you know, is so important for your face and your skin. It is hugely important also for your scalp, and it's a very highly missed area because as we thin, we are more prone to getting sunburns, and sunburns do breed skin cancers. Remember, 1 in 5 adults will get skin cancer over their lifetime, and a common place can be the scalp. So we may just, you know, obviously want to add a good sunblock that's more of a spray, it's mineral based so that you don't have that risk. Next slide. All right, so if you haven't already checked out the products, these are the QR codes that I've had all throughout. So if you're interested in the men or women's line, you can QR code it and basically add it to your cart. The beauty is everything is on special with our kits. There's, I think, 11 different kits there. 23% off all kits. Next slide. And then packages are also 33% off. So the ones that are specific to our elite hair treatment packages, we made it very simple for you. We dumbed it down so that it could be very simple as to where do I start? Here are the top 3 packages that I would start with that are 33% off. The first one includes 6 hair genies that you can come in for sessions if you are found to be a good candidate. Package 2 is combining 12, actually doubling that, actually doing more of the laser cap treatments. And then the third one is our Keravive package of 3. So if you're just wanting to baby step it in and just say, okay, let me, or you don't know us and you just want to kind of take a look and go slow, these are the packages for you to get started. In addition to hair kits at home, and Nutrafol. For those of you who are just tired of dealing with this problem, or you've come to Elite MD and you've gotten to know us and you know all of our treatments are always about safety and efficacy and effectiveness, and you know our experts, this transformation package is for you. These are the top two that we have. I've hand designed and picked everything that I could to give you combination therapy with our experts to get you the best results. So with the hair transformation package, you are looking at doing a combination treatment. So it's great for both men and women who have moderate or severe and are just tired of hair thinning and want to do something about it. It includes 6 hair genies and 3 Keravive, as well as Nutrafol supplements here that can be given to you by mail or picking up at the office. And then package 2, if you're really looking to jumpstart this and get this one and done, finally done, this is our Elite Hair Graft. This is where you'd want to come in for a complimentary consultation, see if you qualify. Not everyone will qualify because remember, there's a lot of hair thinning concerns out there. And if you've got more of the genetic and you've tried everything already, you may be a candidate for getting our Elite Hair Graft done. You're one and done for many, many years. This is something you'll want to call us for a complimentary consultation or text us. If you live far away, we do have people that come in from out of town, out of the country. Text us your pictures, text us your hair, and we could do a virtual consultation and help you through the process as well. All right, next slide. And finally, another way that you can save more is join our Elite Club program. Our Elite Club program is really locked in benefits forever. It's kind of like your Netflix subscription where you pay a low monthly payment depending on what you want, what you need. But within the Elite Club, you get discounts on all of your favorite procedures, including Botox, if you get that done, fillers, hydrofacials, body sculpting. There's a bunch of things that are in there. I'll just open the door and unlock all of the savings year round. One of the frequently asked questions I always get is, Dr. Sonia, when's your next promotion coming? Well, Elite Club, you don't have to worry about that. You're locked in to savings all year round. And even if we have a price increase, you're grandfathered in, which is amazing. You get priority booking. You also get free freebies. So at 6 months, you get a free hydrofacial, which is one of my favorite treatments. You get, just for joining, you will actually get an increased savings as well on all of our transformation packages. So if it's something that you're like, look, I get a lot of beauty stuff done, you might as well join the Elite Club. It's our VIP program and it gives you a lot of perks as well. Next slide. So how do you join? Best thing to do is if you already know what you're on, you can always call us. We can help you through it. You'll want to come in for an assessment and ensure that we have the right treatment for you. So this is a long-term treatment plan. So if you get your Botox done, we'll just get you in for every 3 to 4 months. To get your fillers done, we get you in once a year and lock in those discounts for you. So literally all you do is you get a text from us and show up to your appointment. So it's that easy. Next slide. So everyone that has joined us today, by the way, is already entered for raffles, $13,000 in savings. Everyone that is here will also get a free gift in your email about how to take care of your skin and all of my top tips. And then continue to educate yourself. I commend you guys for being here today, and actually all the people that have been at our webinars all week long. I'm really impressed and really proud of you guys for continuing to learn. So resources, always look for resources that are out there that are tried and true. Don't always believe Dr. Google. Go to the experts, go to trusted sites. Here are some of my books on some of the things that, I enjoy writing about, including skin of color and acne and just holistic health. Next slide. The next part of this will be all about you guys. So if you guys are like, hey, I'd love to take a look and see how's Elite Hair Graft performed. Well, we have a treat for you all week long. We've actually had patients getting Elite Hair Graft. And today we have a patient that we're going to be featuring on Instagram. And you can actually talk to them, be able to ask questions, and you'll get to see a treatment actually being done. For those of you, thank you for the chat box questions. If you're interested in scheduling complimentary consultation, our Phone numbers on our website. It's also in the chat box. You can also Clara or text us if you want some photos. But all of our staff is on standby to answer questions and get you into the office. We have a busy week ahead, so we'll do our best to get you in. But definitely join us on Instagram. We're going to be getting started in another 10 minutes if you guys are interested in watching an actual live procedure. So I hope you guys will join us there. If you guys have any other questions, let us know, but I hope this was helpful and informative. And my main concern is to make sure you know that you've got options and what you can do about some of these common things that I see, which is hair thinning. Tomorrow, join us. We're going to be talking about age-defying options. So if you've got lines and wrinkles and you don't quite know what to do or what's the best treatment, we're going to be offering some options for you tomorrow, as well as some wonderful promotions. And Friday, it's all about sun damage. So sun damage, skin cancers, what to look out for, what can you do to prevent sun damage and future skin cancer. So I hope you guys will tune in again at noon and join us there. Thank you guys so much for attending today. And I can't wait to see you guys in the office. I'll be here all day today and tomorrow. So hopefully I'll get a chance to see you guys. Take care. Have a good day.